Right here, News Radio 700 WLW. Football just around the corner. Of course, we learned yesterday devastating news out of Bengaldom that Cincinnati Bengals first-round draft pick Jonah Williams, offensive tackle, who was projected to start at left tackle, by the way, which I don't know about you, but I consider that a pretty important position when you're protecting a quarterback. But nonetheless, he was drafted 11th overall at Alabama. He was going to be the guy to jump in and take over, but he wound up getting hurt. And Coach Zach Taylor, new Coach Taylor, said he's a little dinged up after workouts, and it turns out he has a torn labrum. And he's going to go undergo surgery if he hasn't already, expected to make a full recovery. But the problem is he's going to miss the entirety of the 2019 campaign. You often hear about a labrum, a torn labrum, or this injury, that. Let's catch up with, from Beacon Orthopaedics and Sports Medicine, Dr. David Argo, who that's his specialty. He's strictly a labrum guy. He's an ortho guy. He also does microscopic surgery and like stuff that ordinary people like me and you don't understand. Dr. Argo, welcome to the show. How are you?
Thank you. Very well. Thank you.
Good. All right. So let's get into your specialty here. You hear about Jonah Williams. Go, okay, a labrum. Doesn't sound that serious. I've heard people that have had tears of the labrum and said, well, doc said, you don't really need surgery. Is it an age thing? What is the labrum? What's it do?
Well, the labrum is similar to a gasket that sits around the socket part of the shoulder. So if you think of the socket almost like a golf tee and the ball of your shoulder being the golf ball, it actually forms a little ridge around that socket that is like a gasket that helps support and hold the ball in the socket.
Okay, and if that thing tears, then obviously the shoulder's loose, it moves around. Is there a lot of pain?
Right. It's the biggest thing is you get what's called instability, where you go to push on something and you'll feel the ball move in the shoulder instead of being stable. And instability in the shoulder in a professional athlete is really compromising their ability to perform their job.
Yeah, absolutely. So you'd have to go in and what do you do surgically to the labrum?
Typically, we go in arthroscopically, and we actually sew the labrum right back down to the bone where it's supposed to be, right on the edge of the socket. And that's what makes it a little bit kind of a highly skilled surgery, in that you have to have it put back exactly where it's supposed to be in the right way without compromising the blood flow to it. And there's little techniques that have to be done. But that surgery is a very, very good surgery as far as the outcomes.
Yeah, and sounds like it's fairly straightforward as what you have to do going to the shoulder arthroscopically and reconnect the labrum to the bone. But obviously what takes a lot of time is the healing, right? Because it has to attach itself to the bone.
Exactly. So it usually just kind of in the general world of orthopedics is soft tissue healing to something, so a ligament or a tendon or a labrum healing back to bone is usually about 3 months just for the healing. And then because you haven't used the shoulder for 3 months, it takes about another 3 months to get it built back up into playing condition. And that's so if you're looking at now, you're thinking, this was the 1st of July. You've got 6-7 months before someone's back on the field, especially at that level.
Yeah, because you're talking about probably 3 months of immobilization and then physical therapy, and then eventually, once you're cleared, you can get back to lifting weights. But then you got to get your strength back. That's the hard part.
Exactly. So, especially at his position, as he goes and looks forward to the future, we obviously I haven't actually taken care of him or seen him, but the position similar to that, the strength that's required to be a offensive lineman in the NFL, you don't want to be out there with a wounded wing. So it's at least 6 months before he'll be back into football-related activities, is the term they use. But to be back full form, it's going to be probably a good 9 months.
Talked to Dr. David Argo at Beacon Orthopaedics and about the situation involving Jonah Williams from the Cincinnati Bengals and missing the entire season because of a torn labrum. But I thought I've heard, too, from older people, you'll look at them and go, well, you know what, we could do surgery, but don't worry about it. Is that true?
Absolutely. So a lot of labral tears don't need to be fixed because they're not having that stress on the shoulder. On your daily life, you're not trying to move a 300-pound person that's in front of you in a violent motion.
I don't know. Do you ever see Seg here on Chicken Day? When the chicken comes in.
It's Ron's roost. Right?
David, when Ron's roost comes in, some people have to move him out of the way. So I may need the power of a linebacker. Don't say that. That's important.
But I do think, I do a lot of labral surgeries on folks that are construction workers or power line workers, or people who really have to use their force above their head or above shoulder height. If they're using there, then yeah, we'll go in and repair the labrum or address whatever pathology is there.
Yeah, it's interesting because, you get to a certain age and you go, God, my shoulder, this, that, and you go, yeah, you can either have the surgery, but, it's fine. Is the labrum only found in the shoulder?
I'm sorry, I didn't hear that.
Is the labrum only found in the shoulder? Do we have labrums in other parts of your body?
There's a labrum in the hip as well. Yeah. And if you remember, Devin Mesoraco had tears in both of his labrums in his hips. It's the same thing. It's that gasket that just kind of, it's fibrocartilage that surrounds the joint to kind of give the ball and socket stability. But yeah, you can tear a labrum in your hip or your shoulder.
You do that as well too. So, I guess the other thing is in the shoulder too, because it's such a the one joint that you can move. I guess it's the most mobile joint in your body, right? Because you can up, down,
yes,
and there's so many different things in there too. Because you go, okay, well, I got a labrum, but then there's other things. Typically, what do you see going wrong as you cross the age of, let's say, 40 into 50? When you do shoulder stuff, what are you looking at for the typical person?
The typical person is rotator cuff. The rotator cuff is inflamed or has a partial tear. And there's some studies that actually show that 60% of people over the age of 60 have rotator cuff pathology, meaning that there's something, either tears or fraying or a bone spur or those kind of things that's rubbing on the rotator cuff that cause people. The biggest complaint is people have trouble sleeping. They can't get in that position and where they're either hands above their head or they're down by their side or they're lying on that side. They're really miserable. And that's when I tell people, if it's interfering with your sleep, interfering with your life, come in and see me and we'll get that fixed. It's
funny. There's a lot of things you go off to the doctor, but orthopedics is a funny one because people go, yeah, God, my shoulder hurt. What do you think? And ask like guys on the street, what do you think this? What do you think this is? I'm like, well, go see Argo. Go to Beacon. Go ask these guys. What the hell are you asking me for? But no, and having been around sports too, you kind of learn some of the tests that you do on like football on the sidelines, for example,
Absolutely.
for a torn rotator cuff, which is okay if you want to know if your rotator cuff. How do you test for that?
Well, the easiest way is to kind of hold your arm out to the side and have someone push down on it. And if you can resist them, normally your rotator cuff is okay.
Is that the Thompson test? Is that what it's called?
Well, there's called a supraspinatus isolation test.
Gotcha.
And then there's a Whipple test, and then there's
all these tests. It's really hard. You got to study
all kinds of names. You kind of have to go to medical school.
If you hold your arm out to your side, parallel to your shoulder, and someone pushes down, and there's no resistance there, and it hurts. That's a good indicator, right?
Then it's torn.
Yeah. Then you got problems. That's a problem.
Right.
That's a problem right there. Yeah. So typically people present with that. What about some of the issues of the bone in the shoulder?
Well, arthritis of the shoulder is a big one. In our athletes, we see a lot of people with joint pain right at the end of the clavicle, the collarbone, where it comes over to the joint. It's called the AC joint. Right. And that's when people have a AC joint, or people call it a shoulder separation. We see that a lot in football, rugby, soccer, and hockey. Those are probably the three biggest because they hit things and the shoulder subluxes and the AC joint separates. And that's a shoulder separation. Pretty common, and that's where you have pain right on that little bump that's on the front of your shoulder that you can feel.
Gotcha. My brother had something like that. They had to grind it down. What is that one?
Yeah, that's called the Mumford procedure. That's where you develop a bone spur underneath the AC joint and actually start rubbing on the rotator cuff underneath it. So we go in and shave that out.
Yeah, that sounds like a great. Yeah, it sounds like a good time.
Procedure.
Yeah, it's a great procedure. I'm sure the recovery's awesome there, right?
Yeah, it hurts pretty severely for the first 3 to 4 weeks.
As you know, the Bengals' first-round draft pick, 11th overall, is out for the entire year because of a torn labrum. We're talking to Dr. David Argo from over at Beacon and about the procedure, the recovery. And people go, labrum, what? That's not that big a deal. Kind of is if you're a big guy because it's all upper body. It has to do with your shoulder. And if you're pushing off and your job is to block, you're not going to be very effective with one arm. So you want that taken care of, and hopefully he'll be back. And as you said, a professional athlete, Dr. Argo, can make a full recovery. He's going to be fine.
Absolutely. In the hands of a good surgeon, it's an easy repair process. And, and professional athletes are used to recovery and used to training their bodies to get back. And he'll go through a full rehab program that will be intense, and he'll work right through. I have no doubt that he'll be back.
Okay. And on that, too, is okay, the regular person, a normal person, is like, yeah, you can get by without having that. But when you get to torn rotator cuffs and other issues, your AC joint and things, what about osteoarthritis? That's a big one. I actually went in there months ago and saw your colleague Velasquez and said, hey, you're old. You got OA of the right shoulder. And I'm like, oh, that's awesome. What can be done for arthritis?
Well, there's things, because the shoulder joint is not technically a load-bearing joint. Cortisone injections, lubricating gel shots, some real aggressive therapy to stretch out the joint. Those things can all do really, really well for a long time. But there is actually a shoulder replacement that is similar to a hip replacement or a knee replacement. We actually do shoulder replacements, and we have a couple of guys in our group that do really good shoulder replacements if people need those.
Yeah, and I guess you don't have to really live with that pain as much, too, and having some of those injections. What about the stem cell thing? I've been hearing a lot of good things about stem cell.
Yeah, we do a bunch of stem cells, and I've injected those in the shoulder. The thing about stem cells is that there's never been an FDA-approved study that says that it made a difference. But multiple of my patients we do stem cells on, they'll come back and they'll say, my shoulder hasn't felt this good in 20 years. So anecdotally, it sounds, the stem cells we offer as something that's available, we try not to over-promote it, oversell it, because it's not a cure-all for everybody. But for a lot of folks, it does make a difference.
Yeah, but the problem right now, it's cost prohibitive, right? It's pretty expensive.
Yeah, it's somewhere between $3,000 and $5,000, depending on exactly what you do for one shot. And insurance does not cover it.
Right, so it's completely and utterly out of pocket. But
yeah.
And what percentage typically does the stem cell injection work, or is it just simply so new you don't know?
It's so new, and especially in the shoulder. It's so new that I'd love to tell you it's 100%, but the handful that we've done recently have done incredible. Yeah. But one of the expressions in orthopedics is that nothing ruins good results like long-term follow-up. and we don't have long-term follow-up, so it's hard to say, gosh, yeah, you want to try this. It's worth $5,000 or worth $3,000. Right. But, we offer it. Some people come in and have done their own research, and they have a full list, and they say, I want this and this, almost like picking from a menu. We take care of them.
Yeah, that's the interesting part of the stem cell injections. So people who may have a religious or philosophical issue with the stem cells, where are they harvested from? Well,
they can either be taken from your pelvis. We draw them out, spin it around the machine, and it separates out the stem cells with this photoelectric sensitive separating machine, and we inject them in. But if you're over the age of 50, your viable stem cell count really drops. Right. So we take them from donors that are dead people, right, that donated their parts. We take them from the spine, the marrow of the spine. So there's nobody dying. It's not taken from babies. It's not taken from embryos. It's not taken from cord. It's taken from the donors who have passed, who donated their bodies, and usually it's under the age of 24. So it's kind of specific of and they've been screened for diseases and all those kind of things, and it's stem cells. So there's really minimal, if any, disease transmission, and let's say no animals were harmed for that study or anything. So.
Yeah, and I guess, it said you could harvest it from you, but if my stem cells were any good, I wouldn't have to get stem cells in the first place. Why would I want my crappy? I wanted some kid stem cells. I don't want mine. I want some young, healthy guy.
Well, I have people that say that, and I have other people say just the opposite. I don't want anybody else's stuff. Give me mine. And so we do both.
I saw a case study of the stem cell. It's really interesting, where this woman who is a lifelong runner by her 50s, obviously her knees go up because running generally outside marathons is not good for your body. Asked my friend Julie Isperding about health issues and the like. And anyway, they injected both knees with the stem cells, and she said within a few weeks she was back to running and had absolutely no pain whatsoever. It's incredible.
Yeah, I've done the same procedure for my own brother. And he's a runner. He's hoping to run in a marathon or a half marathon in a couple of weeks. So
that's an amazing thing. Would you say that's the next big thing in orthopedics? Is the stem cells is to fix people?
Yeah, I think orthobiologics, which is that whole category of using our own body's mechanisms and natural healing processes is going to be the next advancement. It's going to be huge in the next probably 10 to 15 years, these things will be perfected, the studies will be in, and evidence will support their use even more.
Yeah, it really is incredible. What we're able to do, and I've talked about my mom who passed away, but she had CAR T therapy for non-Hodgkin's lymphoma. It didn't work for her, but the hope is that they're able to cure cancer using your own cells too, and manipulating them in a lab. And we're at the cusp, I think, on maybe the golden era of medicine. You know, there's so much we don't know about her, about the body. You know, I've often asked, well, how did she get cancer? How's this person? We don't know. We think we know a lot, but on the surface, we're just kind of scratching the surface when it comes to a lot of areas of our body, and I'd say orthopedics included, that we don't know. We're starting to learn a lot more, though.
Absolutely. That whole cancer thing is just baffling. Why one person would get cancer and the person right next to him doesn't. It doesn't make a lot of sense to us. But I think, like you said, the biology and all those smart people out there doing genetics are going to figure out the key, the thing that turns on the cancer cell. They're going to figure that out, and then we can pretty much do away with cancer at some point.
Right. All right. Again, it's Dr. David Argo at Beacon Orthopaedic and Sports Medicine, working under the thumb of Tim Kremchek. But I say you take over in some sort of bloody coup, Argo. I like you. You're a good guy.
Tim's a friend, so we're partners. We support each other. So
that's the best. No, and again, thanks for coming on the show, explaining the labrum thing, and if you're having aches and pains and the like, now you know what's going on with your shoulders. And again, as the older we get and the longer we live, there's no shortage of work for you, Doctor.
That's right.
No doubt about it. Thanks again. Have a great day. Appreciate it.
You're welcome. Thank you.
Yeah, there you go. We got about